Nigeria, healthcare is not a necessity, it's a privilege. Despite Nigeria's economic strength, the country has one of the worst healthcare systems in the world. The latest WHO survey ranks Nigeria's healthcare system as the fourth worst in the entire world. This horrendous statistic might be shocking to an outsider. However, it would not come as a surprise to Nigeria's citizens, as the country barely even has an ambulance service or simple toll-free number like 999 for emergencies. Meaning, in the unfortunate event of a heart attack, your chances of survival are dire. You are 20 times more likely to die of a heart attack in Nigeria than in many developed countries, like the U.K. and France. This is a story of how Nigeria's healthcare system has been crippled and left in the dust by its own ruling elite. Let us do a brief description of Nigeria's healthcare situation. Nigeria's healthcare system is facing serious constraints, with many fearing that the entire system is on the verge of tipping over. Basic hospital supplies and personal protective equipment is barely available, coupled with limited procedures due to staff shortages and inadequate diagnostic equipment like ultrasound machines, not to mention the massive shortage in MRI machines and CT machines. All these lead to what can only be termed as a health emergency due to little or no government concern for even the basic healthcare needs of everyday Nigerian citizens. With even the basic healthcare needs of the majority of the Nigerian population unable to be met, it's given way to serious criticism both nationally and internationally, with many Nigerians who now term their own public hospitals as the place where people go to die. With a public healthcare system that is characterized by a shortage of drugs, equipment, and medical specialists, Nigerians disheartened by their healthcare system see no way out of the mess their own government has put them under. Many Nigerians have even resigned themselves to the possibility of early death if unfortunate to be struck by any serious illness. Apart from Nigeria's top private hospitals, the majority of hospitals in Nigeria are no more than mere consulting rooms, lacking in everything. Even empathy is in short supply, with the poor bearing the brunt of ill treatment from health workers, overwhelmed themselves by the daily throng of patients needing care. With patients required to meet the full cost of treatment, Nigeria's healthcare system has literally priced out access for over 100 million citizens living in poverty. Hospitals, however, would be forced to close if not able to recover the full cost of treatment from patients in the absence of adequate funding from the government. It is not uncommon in Nigeria for patients to be held hostage in wards until a kind benefactor pays their medical bills. For very serious medical conditions, deposits of over 500,000 naira are required before treatment can even commence. This is simply an impossibility for over half the population of the entire country to afford it, as more than 100 million Nigerians are still in poverty. Unfortunately, inadequate funding is not the only issue that Nigerians face, as it is just one of the multifaceted challenges plaguing the healthcare system in the country. Much has been said about the problem of quacks in the system and the risk these individuals pose to the lives of patients. Here is a very worrisome social media account from a health practitioner.
A patient was receiving treatment as a diabetic for 12 years only to find she was never diabetic. A doctor without any formal surgical training was alleged to have performed a complicated bowel surgery on a patient who died in the operation. A patient bled to death after a doctor carried out a renal biopsy without a simple medication history that would have revealed that the patient was on aspirin, a blood-thinning agent. A doctor administered a dextrose drip on an unconscious patient without first checking if the patient was diabetic. Then the patient never woke. Another diagnosed bone tuberculosis by just looking at a patient's jaw without doing a single investigation and was found to have a benign lymph node.
All these allegations, grave as they are, should not diminish the hard work of the vast majority of doctors and health workers who continue to do their best for patients with little resources and under very difficult circumstances. Some owed many months of unpaid salaries and allowances. The most disheartening aspect of this is the fact that most Nigerian top physicians and healthcare workers aren't practicing in the country. There are more Nigerian surgeons in Los Angeles than there are in the entire mainland of Nigeria. This migration of highly skilled Nigerians is due to the terrible and horrendous conditions they would have to work in if they stayed in the country, which will be coupled with meager pay, of course. A House of Commons report in 2020 revealed that 8,241 Nigerians are currently working in various capacities in the National Healthcare Service, or NHS, in just England alone. More are on their way for sure. Now, let us see the government's strategy to resolve the crisis. Despite the dire state of Nigeria's healthcare system, there seems to be no real tangible strategy by the government to address the challenge facing healthcare delivery in the country and the huge gap in funding. A recent study in the BMC Public Health showed that since the launch of the National Health Insurance Scheme, or the NHIS, in 2005, less than 5% of Nigerians have taken up health insurance, whilst the rest of the population continue to finance their healthcare needs through out-of-pocket expenditure. With dwindling public finances, there is a need for the government to consider compulsory universal earnings, with the poorest citizens entitled to free health insurance. And though this might seem outlandish, it's nothing new on the African continent, and so many other countries and other continents are doing the same thing as well. Universal health insurance had been a great success in Rwanda, considered to have one of the greatest insurance schemes in Africa, with over 90% coverage. That figure alone puts Rwanda in its rightful place amongst the top 10 nations in the world when it comes to insurance and healthcare coverage. The Nigerian government, therefore, has an ultimatum to make the right decisions on healthcare and change the healthcare situation for so many impoverished and suffering Nigerians. Proposed solution to the crisis. The Nigerian government must explore innovative ways of addressing healthcare delivery in the country in a manner that focuses on a partnership between states, the private sector, and the huge talent of Nigerian healthcare professionals in the diaspora. The eradication of polio in Nigeria is just one example of how private money and charitable organizations can partner with the government to deliver the desired health outcomes. It is time for Nigeria's leadership to start building, in Nigeria, those hospitals in Dubai and London. These leaders are fond of patronizing these foreign hospitals. Building good hospitals in Nigeria would spare the country the costs and the ignominy of depending on other countries for the healthcare service they should be providing Nigerians here at home. In the event of a heart attack, London would certainly be too far to save anyone. If you enjoyed this video, please give it a like. Also, don't forget to subscribe and become part of our community of touristers here at the New Tourist channel. See you in our next video.